A hypertensive client was prescribed antihypertensive meds. The client tells the nurse that the patient or that she prefers to take herbal supplements to help lower her blood pressure. The most appropriate response from the nurse is to encourage the client to discuss the use of herbal supplements with her attending care physician or provider. Herbal supplements are not regulated in the same manner as traditional pharmacy dispensed medication. Although the use of some herbal supplements may provide some beneficial effects, but not all herbal supplements are safe for use. One herbal therapies, ginkgo biloba, is for memory enhancement. Side effect is bleeding. Ginseng is mental performance. Side effect is bleeding. Saw palmetto, used as benign prostatic hyperplasia or BPH, but risk of bleeding. St. John's wort is for depression and insomnia, but risk for hypertension. Decreased effect of anticoagulants. Interacts with antidepressants, steroids, and digoxin. Licorice extract is for ulcers or bronchitis, but side effects would be hypertension and hypokalemia. The patient is recently having a femoral vein catheter placed. The nurse would be most correct in advising the patient that the patient should refrain from sitting up of more than 45 degrees. Patients who have undergone femoral vein catheter should refrain from sitting up of more than 45 degrees because this could kink the catheter. Thus, it will interfere with the treatment. The nurse cares for a client immediately following percutaneous coronary intervention or PCI. Upon sheath removal, the client develops bradycardia and hypotension. The intervention that would be nurse's priority is to administer prescribed bolus of IV fluids. The client presents with signs of vasovagal response that may occur due to pain and baroreceptor stimulation from manual pressure during femoral sheath removal. Decreased heart rate or bradycardia and reduced blood pressure or hypotension are atypical of vasovagal response. Percutaneous coronary intervention is performed in the cardiac catheterization lab and combines clot retrieval, coronary angioplasty, and stent placement. Under fluoroscopic guidance, the cardiologist perform initial coronary angiography, inserting the arterial sheath and advancing catheter retrograde through the aorta. Hypoglycemia. Expected findings would be blurred vision, cool and clammy skin, palpitation, and paresthesia. Hypoglycemia is a blood sugar of less than 70 milligrams per deciliter. Symptoms of hypoglycemia can be divided into two: neurogenic and neuroglycopenic. Neurogenic or autonomic, wherein the adrenergic versus cholinergic symptoms include those from the release of catecholamines such as tremors, palpitations, anxiety, sweating, hunger, and paresthesia, while the neuroglycopenic refers to a deficiency of glucose in the brain and neurons secondary to hypoglycemia. Symptoms of moderate neuroglycopenia include blurred vision, slurred speech, drowsiness, dizziness, extreme fatigue, and severe neuroglycopenia can cause delirium, confusion, and eventually seizure and coma. Signs and symptoms of hypoglycemia: we have sleepiness, sweating, pallor, lack of coordination, irritability, and hunger. GTPAL is a method of calculating gravida, and para is to separate pregnancies and their outcome. Using that acronym GTPAL, G for gravida, T for term, P for preterm, and A for abortion, and L for living. G or pregnancies or gravida, T term pregnancies delivered, P. Preterm pregnancies delivered. A. Abortion. That includes spontaneous and induced. And L. Living children. So if the nurse is assessing a client who is 5 months pregnant and has a son born at 40 weeks of gestation and a daughter born at 33 weeks of gestation, it would be correct for the nurse to document this client GTPAL as G3, T1, P1, A0, L2. Next one, fear and anxiety are quite similar, however there are differences. The statements below that are accurate in terms are differentiating fear from anxiety are: anxiety is secondary to psychological stressor, whereas fear is secondary to a physical or psychological stressor. Fear is a secondary to fear is secondary to an identifiable source, whereas anxiety is secondary to unidentifiable source. The third one is anxiety is diffuse and vague, whereas fear is more specific and definable. Definable. The differentiation between anxiety and fear when it comes to stressor: anxiety stressor is psychological, while fear is physical or psychological. For source, anxiety source is unidentifiable, while the fear is identifiable. And the nature of anxiety is diffuse and vague, and nature of fear is specific and definable. Next question, following a scheduled outpatient radioactive iodine therapy in a nuclear medicine department, the nurse is speaking with the client following the client's ingestion of radioactive iodine regarding strategies to avoid radiating the client's family members. The nurse recognizes that the need for additional client teaching when the client states, "I'll travel for a couple of weeks to prevent my family from receiving radiation from me." The client statement indicates an intent to travel for a couple of weeks to prevent my family from receiving radiation indicates a need for additional client education for various reasons. First, since radioactive iodine emits radiation, the client will be instructed to avoid public transportation like buses, subways, trains, or planes for a minimum of 1 week. Second, typically clients are instructed to avoid close contact with pregnant women, infants, and young children for the first week following therapy. And more specifically, the client should be advised to remain at least 3 feet, about 1 meter away from these individuals, limiting exposure to these types of individuals to no more than 1 hour per day. Clients who receive large doses of radioactive iodine may be instructed to abide by more strict restrictions. While working in the emergency department, the nurse assesses a 3-day-old infant brought in by the mother. The mother states, "My baby is always so sweaty and hot and just doesn't want to eat. I think something is wrong." The nurse is unable to palpate a femoral pulse but notes +3 brachial pulses. Based on this assessment, the congenital heart defect that the nurse will suspect is coarctation of the aorta. The nurse suspects that this infant has coarctation of the aorta. In this defect, there is a stricture in the aorta preventing blood flow out of the left ventricle. It usually occurs beyond the blood vessels that branch off to your upper body and before the blood vessels that lead to your lower body. So blood flow to the upper body is abundant, but hardly any of it can make it to the lower part of the body. Therefore, there are decreased lower extremity pulses and increased upper extremity pulses. Next question, the nurse is caring for a client experiencing delirium tremens. The nurse anticipates a prescription for this medication, which is clonidine. Delirium tremens can be fatal if untreated. DTs result from fluoride alcohol withdrawal, causing the client to experience hallucination, hypertension, agitation, nystagmus, and potential seizure activity. Clonidine is an alpha agonist and is primarily used in the treatment of hypertension. Clonidine is helpful during DTs because it lowers the client's blood pressure and gives the client some drowsiness, which is useful if they are agitated. Delirium tremens are a medical emergency and may cause autonomic hyperactivity, resulting in tachycardia, diaphoresis, fever, anxiety, insomnia, and hypertension. Delusion and visual and tactile hallucination are common in alcohol withdrawal delirium. This may occur within 72 hours following the last alcoholic beverage consumption. Withdrawal seizure may occur within 12 to 24 hours after alcohol cessation. These seizures are generalized and tonic-clonic. Additional seizure may occur within hours of the first seizure. Diazepam is given IV as a common treatment for withdrawal seizure. Nursing care for DTs include rapid assessment of the client's vital signs, initiate seizure precaution and establish patent intravenous access, obtain a prescription of benzodiazepines such as lorazepam or diazepam, administer IV fluids and electrolytes to replete the lost fluids, assess the clients using the CIWA-R scale to trend the severity of the symptoms. The nurse is caring for a client with tracing on the electrocardiogram that may indicate dyspnea or dizziness. The nurse should obtain prescription for, the answer is atropine. When a tracing reflects sinus bradycardia, atropine would be clinically indicated if the client was experiencing symptomatic bradycardia. If the client has bradycardia and concurrent dizziness, hypotension, or dyspnea, this calls for treatment with atropine. Atropine must be administered while an emergency code card is nearby. Sinus bradycardia is a regular rhythm with a rate of less than 60. Sinus bradycardia is only concerning if the client is symptomatic. Pathological causes of bradycardia include severe hypothyroidism, hypothermia, anorexia nervosa, and prolonged hypoxia. For a client receiving IV atropine, the nurse should monitor the heart rate and rhythm after administration. An increased heart rate is expected. Histamine manifestation. Histamine manifestation includes signs and symptoms of erythema, tissue swelling and shock, shortness of breath and wheezing, and itching and painful skin. Next one is about nitroglycerin. The tips to remember when using nitroglycerin is when the patient will say that I will get a refill of my prescription every 6 months. The patient will place the medication in a dark amber bottle and the patient must not chew on the tablet when taking it. Now, if the patient will say that the patient will take 1 tablet every 2 minutes if chest pain occurs, this requires follow-up. When chest pain occurs, the client should take 1 tablet of nitroglycerin sublingually every 5 minutes for 3 doses. Taking the medication too frequently may result in severe hypotension. Nitroglycerin is a potent vasodilator. It decreases preload and afterload. It is indicated in angina. It is given in a variety of preparations, including sublingual, translingual, and topical. Dosing for sublingual nitroglycerin is 1 tablet under the tongue for 5 minutes. As long as the chest pain is persisting, the maximum tablet or sprays is 3. The client should be instructed that emergency care should be sought if the pain is not relieved after the first dose. Nitroglycerin expires after 6 months and the client should be instructed to keep their supply current. Nitrates are contraindicated if the client is taking medications such as vardenafil, tadalafil, and sildenafil. The client should take the nitroglycerin in seating or laying down position because sudden movement changes may cause orthostatic hypotension. Headache is an expected side effect of these medication and may be treated with acetaminophen. Nitroglycerin cannot be applied to a client 24 hours as the client will develop tolerance. Blood pressure should be monitored closely. All right, next question. The client presents for a routine antepartum visit. The primary healthcare provider progress note says a 40-year-old nulliparous female is at 25 gestational weeks of pregnancy. The client is receiving appropriate antepartum care, taking prenatal vitamin, and is appropriately vaccinated. She has a pre-pregnancy medical history of vitamin D deficiency, metabolic syndrome, and hypothyroidism. For nursing assessment, this patient is 40 years old, gestational weeks of 25, height of 5'7", weight is 194 pounds or 88 kilograms, a body mass index of 30, fetal heart rate of 130 beats per minute, vital signs oral temperature of 97 degrees Fahrenheit, pulse 85, respi 16, blood pressure 119/73, and O2 saturation is 96 on room air. Now the question is, the client presents for a routine antepartum visit after reviewing the primary healthcare provider or progress note and the nursing assessment. Which antepartum testing would a primary healthcare provider likely prescribe? The client will need a glucose tolerance test as evidenced by body mass index of 31 and advanced maternal age. The client has a pre-pregnancy medical history of metabolic syndrome, characterized by several metabolic derangements such as abdominal obesity and high fasting blood glucose. This pre-pregnancy medical history is significant for the development of gestational diabetes, along with the client's BMI of 30. Another significant risk factor of this gestational diabetes is the client's age of 40. Advanced maternal age is risk factor of gestational diabetes. The client is at 25 gestational weeks, and considering the risk factor, a prescription for a glucose tolerance test would be anticipated. The fetal heart rate is normal, which is 110 to 160. The client's blood pressure is also normotensive, thus not raising the suspicion of gestational diabetes. The client is at 25 gestational weeks and too early to have a non-stress or contraction stress test. Chorionic villus sampling is a test that may be performed to look for chromosomal abnormalities as early as 10 gestational weeks. An NST can be performed as early as 26 weeks. A CST can be performed as early as 34 weeks. Risk factor for gestational diabetes includes overweight. The normal BMI is 25 to 25.9, or obesity, wherein the BMI is 30 or greater. Maternal age, the overweight pala is 25 to 25.9. Yan yung overweight. Kapag obesity naman, that's BMI of 30 or greater. Maternal age, older than 25 years old. Advanced maternal age, gestational diabetes and previous pregnancy, history of polycystic ovary syndrome, history of prediabetes, first degree relative with diabetes. A glucose tolerance test may be administered between 24 and 28 weeks of gestation if necessary. All right, next question. The nurse is reviewing a newly prescribed medication for an assigned client. Which of the following prescribed medications should the nurse question? The answer is when the doctor prescribes hydrochlorothiazide for a client with hyperparathyroidism. Again, the nurse should question if the doctor will prescribe hydrochlorothiazide for a client with hyperparathyroidism. Hyperparathyroidism causes hypercalcemia, and the treatment for hyperparathyroidism is a combination of 0.9 saline infusion followed by furosemide. Hydrochlorothiazide is a thiazide diuretic and causes the retention of calcium. These would be detrimental for a client experiencing hypercalcemia. This prescribed medication requires follow-up with the prescriber. So side notes, levothyroxine is essential for treatment of mixed edema, a severe form of hypothyroidism. Hydrocortisone is a priority treatment for adrenal insufficiency, as the hallmark of this disease is an insufficient amount of mineralocorticoids and glucocorticoids. DKA is an endocrine emergency and requires aggressive fluid resuscitation and intravenous regular insulin. Hyperparathyroidism is a disorder in which parathyroid secretion of parathyroid hormone is increased, resulting in hypercalcemia, excessive serum calcium levels, and hypophosphatemia, which is inadequate serum phosphorus levels. Diuretic and hydration therapies help reduce serum calcium levels. Furosemide, a diuretic that increases kidney excretion of calcium, is used along with IV saline in large volumes to promote calcium excretion. Next question, you have offered one of your newly admitted clients a partial bed bath. The client states, I took a bath at home 3 days ago. I do not need a bath for another 3 or 4 days. How should you respond to this client? You should respond by saying, that is fine. At what time of the day do you prefer to bathe? And do you prefer a shower or a bathtub? You would respond with this to the patient who doesn't want to take a bath. When one of your newly admitted clients refuses a partial bed bath by stating, I took a bath at home 3 days ago. I do not need a bath for another 3 to 4 days. This response acknowledges the fact that the frequency of bathing or bathing routines and practices vary among individuals and cultures. Clients should be assessed for their bathing needs in preferences of their type of bathing and time of bathing. Additionally, a bath once a week is acceptable as long as the client remains clean, without bodily odors, and is still hygienic. Next question, which of the following statements about carbon monoxide is accurate? The answer is carbon monoxide is a gas that is clear, odorless, and deadly. Carbon monoxide is a gas that is clear, odorless, and deadly. Carbon monoxide is a gas that is clear, odorless, and deadly. This invisible gas can build up in enclosed areas where engines such as car engines or kerosene heaters are running idly. Carbon monoxide poisoning is one of the most common types of fatal poisoning. Consider toxicity in clients with non-specific symptoms or unexplained metabolic acidosis. Do not rule out toxicity based on a normal carbon monoxide level, because levels can decrease rapidly, particularly after treatment with supplemental oxygen. Treat carbon monoxide poisoning clients with 100% oxygen. For severe poisoning, consider treatment with hyperbaric oxygen. Our next question, your client has been diagnosed with chronic pancreatitis secondary to alcohol abuse. Which of the following is the most appropriate tertiary prevention expected outcome for this client? The answer is the client will participate in a 12-step recovery program. The client participating in a 12-step recovery program is the most appropriate tertiary prevention expected outcome, since they have been diagnosed with chronic pancreatitis secondary to alcohol abuse. Tertiary prevention includes rehabilitation, so a 12-step recovery program is a form of these. Levels of prevention, we have 3: primary, secondary, and tertiary. Primary prevention is when intervening before an individual has a health issue. Example, immunization and education. A secondary level of prevention, we have early identification of the disease. We have screenings and health fairs. Tertiary treats the disease and prevents further complication. Example, nutritional education for someone with congestive heart failure. Next question. The nurse is visiting a client who was recently prescribed antihypertensive medication. Which statement, if made by the client, requires follow-up? When the patient says, I started taking my furosemide right before I went to sleep. Furosemide, remember, is a loop diuretic that should be dosed early in the day. This prevents the client from experiencing nocturia. This also reduces the risk of falls by the client, as they will not have to wake up at night when there is reduced lighting. Hypertension treatment, we have A, B, C, D. A for ACE inhibitors, B for beta blockers, C for calcium channel blockers, and D, diuretics. Furosemide is a loop diuretic. Alright, next one we will talk about common herbal therapies. Ginkgo biloba, it is for memory enhancement. However, side effects would be bleeding risk. Same thing with ginseng, which is for mental performance, but it will lead to bleeding risk. Saw palmetto, it's for benign prostatic hyperplasia or BPH, but it will lead to bleeding risk. St. John's wort is used for depression and insomnia, but it may lead to hypertension, decreased effect of anticoagulants, interacts with antidepressants, steroids, and digoxin. Licorice extract used for ulcers and bronchitis, but the side effects would be hypertension and hypokalemia. Now, in a situation wherein a nurse is in an ambulatory care center, which of the patient would the nurse report to the surgeon as possibly needing surgery to be postponed? It's going to be a patient who is taking ginkgo biloba and an aspirin daily. Now we will talk about mastitis. Mastitis is often caused by Staphylococcus aureus or MRSA, methicillin-resistant Staphylococcus aureus, E. coli, and streptococci. The bacteria are most often carried on the skin of the mother or in the mouth of the nose of the newborn. The organism enters through an injured area on the nipple, such as a crack or blister. The primary medical treatment is antibiotics and continued emptying of the breast. Comfort measures during mastitis include applying moist heat or ice packs, breast support, bed rest, fluids, and analgesics. So if you're giving health teaching to a breastfeeding mother, teaching statements, you should tell the mother to continue breastfeeding your child normally, empty each breast at each feeding, complete the entire course of the prescribed antibiotic, wear a supportive bra without an underwire, and continue breastfeeding even if during infection, so do not wean the child. The nurse is assisting the placement of an indwelling Foley catheter in a male patient. The nurse knows to inflate the balloon on the catheter. At which step in the procedure? The answer is after advancing to the point of bifurcation. The nurse should inflate the balloon on the catheter once the nurse reaches the point of bifurcation. This is achieved by slowly advancing the catheter, observing the tubing for urine to appear, and then continuing to advance to the point of bifurcation after urine is observed. These will ensure the balloon is in the bladder before the nurse inflates it. Next question. The nurse is assessing a client with possible bipolar 1 disorder. The nurse anticipates that the primary healthcare provider will prescribe which laboratory testing? The answer is thyroid stimulating hormone. A thyroid stimulating hormone is the standard of care before diagnosing a mood disorder such as bipolar disorder or major depressive disorder. While this test does not confirm the presence of a mood disorder, it excludes alterations of the thyroid, which could alternatively explain the client's symptoms. There are two signs of bipolar disorder: mania and depression. For mania, there will be extreme high energy, grandiose level of self-esteem, loud, rapid speech, very little need for sleep, engaging in risky behaviors such as unprotected sex. For depression, we have feelings of lethargy both physically and mentally, sense of personal worthlessness, eating too much or too little, overwhelming sadness, suicidal ideation. Now let's talk about digoxin. Digoxin is a cardiac glycoside utilized in the treatment of atrial fibrillation and heart failure. While this medication has fallen out of favor because of its numerous interactions, this medication is still available. The apical pulse must be obtained prior to administering the medication. The apical pulse must be at least 60 per minute for adults, 70 per minute for children, and 90 per minute for infants. The therapeutic level of digoxin is 0.5 to 2 ng per ml. Now, the patient needs to understand the importance of digoxin and should also know on how to use digoxin. Now, the patient should know that he or she should take his or her pulse before taking each dose. This medication will require the patient to have a periodic blood work, and the patient needs to ensure to get plenty of potassium in his or her diet. Now, this medication will require the patient to weigh daily, and if there would be some changes with the patient's visual, the patient should not call their eye doctor. The client should notify the medication prescriber, not the eye doctor. No. Alright, now let's proceed to the next subject, which is incident report. Incident, sometimes termed as occurrence or event reporting, is a tool to mitigate future risk. Incident reporting should also be completed for events involving clients and visitors, such as verbal and physical displays of aggression, tampering with medical devices, reports of sexual or physical abuse by the staff, adverse reaction to a blood transfusion, client elopement, damage or loss of client's possessions, falls or injuries related to a medical device, complaints, medication and treatment errors interfering with client care. The incident should not be logged in the medical record or nursing notes. In the event the record goes to court, which can make it discoverable. The documentation should be objective and factual, including what occurred, any injuries, if the provider was notified, care administered after the event, and any witnesses. Now, an incident, sometimes termed as an event or occurrence report, is completed for situations such as client fall, medication error, visitor fall, assault from visitor or client, accidental discarding of client's property, and a delay in care. The report is the facility's property and should not be mentioned in the client's medical record, including the nursing notes. So, when you were told by the nurse that the documents in the nursing notes are done or completed, that should not be the case. Next one is blood transfusion reaction. During an assessment, the nurse notes that the patient's respirations are rapid, the face is flushed, and the patient is complaining of itching. The nurse suspects the patient is having transfusion reaction. The nurse should accomplish the following action in order. Again, they should be in order. The first one is to stop the transfusion. Number 2 is to administer oxygen. Number 3 is to take vital signs. And number 4, obtain a urine specimen. Alright, next one we will talk about fluids and electrolytes. It would be correct for the nurse to state that the role of calcium is to promote blood clotting, increase bone density, promote healthy dentition, and maintain neuromuscular health. Calcium is the most abundant mineral in the body and is essential for many important functions, including bone and teeth health, muscle function, nerve transmission, blood clotting, and hormone secretion. Calcium plays a role in the secretion of hormones such as insulin, which regulate the body's metabolism and energy production. Inadequate calcium intake can lead to various health problems, including osteoporosis, muscle cramps, and heart problems. Consuming sufficient amounts of calcium through a balanced diet that includes dairy products, leafy greens, nuts, and fortified foods is important. Now we'll talk about delegation. The church nurse is planning client care assignments for a registered nurse and a licensed practical or vocational nurse. Which of the following clients would be most appropriate to assign to the LPN? The choices are a client requiring assistance picking out low potassium foods, a client requesting to leave the facility against medical advice, a client needing several prescriptions called into the local pharmacy, or a client requesting breakthrough IV push pain medicine. The answer would be a client needing several prescriptions called into the local pharmacy. A client requiring prescriptions called into a pharmacy is appropriate for an LPN. The rest of the options require a registered nurse. An LPN may receive telephone orders from a primary healthcare provider and call in the appropriate prescriptions when necessary. Now we will talk about severe preeclampsia. If one or more of the following criteria are present, like blood pressure of more than or equal to 160 mmHg systolic, or 110 or equal to or higher than 110 mmHg diastolic, or higher on 2 occasions at least 6 hours apart while the patient is on bed rest, oliguria of less than 500 ml in 24 hours, cerebral or visual disturbances, pulmonary edema or cyanosis, epigastric or right upper quadrant pain, impaired liver function as indicated by abnormally elevated blood concentrations of liver enzymes to twice normal concentration, severe persistent right upper quadrant or epigastric pain, unresponsive to medicine or medication and not accounted for by alternative diagnosis or both, thrombocytopenia, and renal insufficiency. Alright, the next one that we will talk about is presbycusis. Presbycusis is a type of sensorineural hearing loss associated with aging. Sensorineural hearing loss is often permanent. Interventions for a client with this type of hearing loss include speaking in the ear lest affected, speak clearly and slowly, avoid shouting, and ensure that the environment is well lit while conversing. Hearing loss is divided into sensorineural or conductive. Conductive hearing loss is caused by obstruction. Causes of this type of hearing loss include cerumen, foreign body, water, edema, infection, or tumor. This type of hearing loss may be reversible. Impairments of the nerve fibers cause sensorineural hearing loss. Causes of this type of hearing loss include prolonged exposure to noise, autotoxic substances or aminoglycosides, diabetes mellitus, and presbycusis, which is age-related hearing loss. This type of hearing loss is often not reversible. A borderline personality disorder is about 5 times more common in first-degree biological relatives with the same disorder compared with the general population. This disorder is characterized by the individual having an unstable self-image, fear of rejection, impulsivity, and emotional dysregulation. A key intervention for a client with BPD is to assess for suicidality. Parasuicide is common with the personality disorder. However, it is essential to keep this client safe. Defense mechanism commonly seen in this personality disorder includes splitting, projective identification, and denial. Treatment is therapy, specifically dialectical behavioral therapy, which focuses on the emotional regulation and strategies to respond to stressors in a mature way. No medication is approved to treat any personality disorder. Next one, the nurse is assessing a client diagnosed with pneumothorax with a water-sealed chest tube placed 3 hours ago. The nurse observes no tidalling in the water sealed chamber. The nurse should take which action? Assess the tubing for any kinks. Tidalling in the water-sealed chamber along with intermittent bubbling is expected for a client with pneumothorax. If tidalling and intermittent bubbling have stopped, it could indicate a positive finding such as the resolution of the pneumothorax. Considering that this client had this device placed 3 hours ago, a resolution is unlikely. The more likely finding is that a portion of the tubing is kinked or obstructed, which has stopped the tidalling in the water-sealed chamber.